Assalamualaikum and greetings to everyone. We are from Group 6 and we will be presenting about a sexual variant known as gender dysphoria. I am Nur Amira and my group mates are Fatima Pandey Putri, Chut Putri, Nur Zahira and Kurata Afika. So for today, we'll be discussing about the introduction to gender dysphoria, the clinical features presented, the relevant scenes on how or to what extent their condition affect their daily functioning, factors that contribute to their psychological disorder, action taken or decisions by expert parties on their condition, and the conclusion of this study. So this is the poster of gender dysphoria that our group have made that consists of the general knowledge of gender dysphoria and the discussion of a chosen case study. So what is gender dysphoria? According to DSM-5, gender dysphoria is defined as the dissatisfaction when one's sex-related physical traits or given gender. And the prevalence of gender dysphoria is it affects 0.005 to 0.014% of adult natal males and 0.002 until 0.003% of adult natal females. There are two diagnoses of gender dysphoria, which are childhood diagnosis and adolescence or adulthood diagnosis, according to DSM-5 that we'll be discussing next. For the childhood diagnosis, children will experience a 6-month period of marked incongruence between one expressed gender and assigned gender. They will have a strong desire or urge to be of the opposite gender. The most common adult outcome of boys who experience gender dysphoria in their childhood is homosexuality rather than transsexualism. However, the adult outcome of girls with gender dysphoria is less clear as there are only small studies done. Clinically, substantial distress or impairment in social, school, or other critical areas of functioning are linked to this condition. The diagnosis for gender dysphoria in adolescent or adulthood there will be a large disparity between one expressed or experienced gender and main and or secondary sex traits, as well as a strong desire to eliminate primary and or secondary sex characteristic and prevent secondary traits from developing. Primary sexual traits are present at birth and comprise the external and internal genitalia, while secondary sexual characteristics are those that emerge during the prepubescent through postpubescent phase. This adult will also wish to be and to be treated as the other gender and possesses a strong belief that they share the usual sentiments and reactions of the opposite gender. This condition is linked with clinically substantial distress or impairment in social, occupational, or other crucial aspects of functioning, and the most common outcome for this diagnosis is transsexualism, and there are three types of transsexualism, which are transsexuals, which is adults who want to change their sex, homosexual transsexuals, individuals who identify as transgender or transsexual and are drawn to the others of the same sex, and autogynephilic transsexuals, which is sexual excitement of a male and seeing himself as a woman, which is a paraphilia. In this study, we will be reviewing a case report of morbid jealousy and gender dysphoria in a natal female where the patient, a 24-year-old designated female at birth named Miss T, revealed a history of having a strong desire to be a man since he was a little child.
Assalamualaikum and hi, my name is Nur Zahira and I'll be presenting the clinical features presented. Basically, gender dysphoria is commonly associated in a variety of ways, including strong desires to be treated as the other gender or to be get rid of one sex characteristic, or a firm conviction that one has feelings and reactions typical of the other gender, which are often directly related to gender dysphoria. First of all, girls with gender dysphoria may be portrayed as having the preference for wearing only masculine clothing and engaging in activities or having rough and tumble play along with the other boys. In the same case, a boy patient with body dysphoria or gender dysphoria would be preoccupied with feminine activities. They also would most likely preferring cross-dressing than normal dressing. Co-occurring the risk of having comorbid mood disorder and anxiety, often secondary to gender dysphoria. It is a common thing, and also people intentional self-injury in the form of suicide thoughts, behavior, or non-suicidal self-injury is a primary concern for people among gender dysphoria. That is all from me. Thank you so much. I'll be passing to the next member.
Hi, my name is Kurata Afika and I will continue the presentation by explaining the relevant scene for this case study. The major relevant scenes that can be seen is when Miss T, which is female at birth, started to develop a habit to dress like a boy, playing often the stereotype boyish games along with other boys. This is the beginning of its changes in behavior, thoughts, and feelings. As she grew older, she started to feel attracted to women instead of men because she believed that she had the same feelings and reaction just like an ordinary male. When she started her relationship with her girlfriend, she also considered that she was in heterosexual types of relationship instead of lesbian relationship. After her girlfriend left her for another man, she started to develop a lot of symptoms of mental illness, such as suicidal attempts, irritability, worthlessness, and was admitted to the hospital. She even considered getting a surgery to change her gender, since she thought that there is no worth in living if she was trapped inside the woman's body. All of these things mentioned affect her daily functioning and cause her to unable to carry out her daily activities as before. That is all for my part. I pass to the next presenter. Thank you.
Next, me Fatima will explain about the factors that influence gender dysphoria. In overall, the factors of gender dysphoria are not fully understood, but there are several factors that consider have an influence such as genetic, prenatal hormonal influence, parenting, and environment. In this case, Misty shown abnormal behavior such as prefer to dress like a boy, playing the stereotype boys games along with other boys since her childhood. Factors that influencing Misty is parenting. Misty father, who has no sons, encouraged Misty to dress and behave like a boy, which as Misty older made Misty more sure that she is a man trapped in a woman's body. That's all from me. I will leave it to the next presenter. Thank you.
Hello, my name is Putri and I will explain about the program or therapy. So based on the case, it was explained that Misty developed a depressive disorder as a result of being abandoned by her partner, and she developed symptoms such as irritability, helplessness, worthlessness, suicidal ideation, and attempt suicide over the past 4 until 6 months. She stayed in the hospital for 10 days, undergoing supportive psychotherapy to reduce depressive ideas and supported by consuming SSRIs or selective serotonin reuptake inhibitors. SSRIs or selective serotonin reuptake inhibitors are a group of drugs used to control or reduce mild to severe depression such as that experienced by Misty. SSRIs work by increasing levels of serotonin that plays an important role in regulating mood, sleep, and appetite. SSRIs prevent serotonin from being reabsorbed into nerve cells, so serotonin levels in the brain increase and symptoms of depression can be reduced. Another treatment that can be suggested to treat gender dysphoria is medical treatment, which consists of hormonal treatment and surgical treatment. Hormonal treatment can help change the patient's identity for the better, such as feminizing hormone therapy and masculinizing hormone therapy, while surgical treatment is surgery to change the breast, external genitalia, inner genitalia, facial features, and body shape. Besides medical treatment, there is another treatment that can be done to treat gender dysphoria. That is behavioral treatment. Behavioral treatment is a treatment that aims to change negative behaviors that can harm the patient and treat thoughts and feelings that can lead to self-harming behavior. This therapy helps the patient to gradually accept the gender requirements that they have had since birth, and based on the Misty age is 24 years old or adult category, so she can undergo this therapy by joining the individualization with the therapist. Thank you.
In conclusion, gender dysphoria is a type of sexual variation that can affect anyone regardless of their age. There are two types of diagnosis of gender dysphoria, which are childhood diagnosis and adolescent or adulthood diagnosis. In this case report, it can be seen that Miss T experienced gender dysphoria, where it was proven based on the childhood diagnosis, where she prefers to dress like a boy and do boys-related activities, and also based on adolescence or adulthood diagnosis, where she believed that she shared the same sentiment and feelings as the opposite gender. Her desire to be a man was driven by her father, who has no son, who encouraged her to dress like a boy, and due to the condition where she experienced gender dysphoria and depression due to her relationship, she underwent supportive psychotherapy for 10 days in the hospital and consumed selective serotonin reuptake inhibitors. It is critical to increase awareness about this topic since it may help people better understand themselves. It is the obligation of the people to help raise this knowledge, which can be done through social media, as it can assist in boosting awareness, particularly among younger generations, and encourage people to explore their own identities. That is all from our group presentation. Thank you for listening.